Rebecca Schneider works as a physician scientist and her group studies blood cancer. With the help of the Oncode business development team, she established a collaboration with biotech company Active Biotech, aiming to clinically develop a novel drug.
So I'm a pathologist by training, and for me everything starts by looking at a disease under a microscope. And this is exactly where my research question started, because we see these changes in a chronic blood cancer, which actually leads to scarring of the bone marrow, so replacement of normal blood formation by scarring tissue, by fibers. And I wanted to understand what's happening in the disease, and found that it's like really frustrating that we don't have a biomarker, and we can only say there are fibers or there are no fibers, but we don't have anything at hand to say a patient is at risk to develop this disease.
And you figured out there's a biomarker you can target in this disease, and you can actually monitor it. And I think there's a very cool new development now that you're also testing actually a drug against this biomarker together with Active Biotech, a company. So how's this collaboration going?
Yeah, it was very exciting to us that we found this drug, tasquinimod, which was made by Active Biotech, and they applied it in prostate cancer. And it never made it to the market, but we have seen really striking success using this drug in our mouse model. And then we contacted the company, or I did, and in a very naive way, basically saying we have these very exciting results in our mouse model. Can we talk? Can we develop something together? And this did not work out so well in the beginning. And this is exactly the time when Oncode stepped in and helped me basically to talk to the company, to develop a plan, what to propose, and actually to see in the end that it's a win-win situation.
Okay, so what's the process now? Is there a clinical trial being set up or already running?
Yeah, we were very lucky that we were awarded one of the clinical proof of concept grants by Oncode, and this really made a huge change. It's really a game changer for us, because otherwise we wouldn't have gotten this type of funding for this rather rare disease. And now we can really move our findings into a clinical setting, and we're doing this at the moment, and we will actually start recruiting patients by the end of the year.
In 2021, the PERSIST-Seq consortium was funded by the IMI. Led by Oncode Institute and AstraZeneca, Alexander van Oudenaarde is the principal investigator. The goal of the public-private consortium is to find out why tumors often return after treatments by using single-cell sequencing approaches.
Well, this project, I think, is very interesting. So it's a very important problem. Resistance to therapy is something we really have to understand to improve therapies. I think second is a very interesting scientific problem. You know, how does it work? Because many of these cells actually, they have this resistance for some time and then they lose it again. How is that possible? And the last thing which I find very interesting is that's a very nice collaboration between many partners, including a lot of industrial partners. And that's for me very new. I'm very curious to collaborate with industry.
So what do you see as the challenge when you have to collaborate a lot?
Yeah, I think the major challenge for this consortium will be to really get, hopefully, general principles out of this. Because we will work on a very diverse range of model systems. This persister phenotype that we're looking for, what the hope will be is that it will be a general phenotype. So we can find this in many experimental systems, and we have to somehow integrate these huge data sets at a certain point. And this will not be easy, but it'll be a very interesting challenge.
So it's about finding common ground then, actually scientifically, but also in collaboration with each other.
Finding common ground and trying to really distill the really general principles out of this very complex data.
So it sounds like a challenging collaboration, but also a very interesting one. So would you have any advice for people in the audience who are seeking new collaborations or different types of collaborations?
I would advise, if you want to collaborate, just directly contact the group, either the PI or the graduate student or postdoc that's working on this. I think this is the most direct way to collaborate. Of course, you can start this big consortia, but you know, that will take a lot of time. If you are interested in collaborating with somebody, just talk to this person, have a coffee, and figure out how this group can help your research.
What's your favorite gene?
My favorite gene is HMGA1.
B53.
All of them are just amazing. They just create this amazing machinery at the end, which is basically, directing the whole life.
Miao Ping Chen established a technological approach to address cellular heterogeneity. For a pool of cells, she can analyze different morphological and protein expression aspects, select cells of interest based on these features, and subsequently sequence the DNA of those cells.
The technology actually have three important elements. They have to come together in order for this technology to happen. So the first one is a microscope. So we need a microscope that can help us capture a lot of cells. When I say a lot of cells, I'm talking about tens of thousands of cells or hundreds of thousands of cells. Second crucial element is advanced real-time imaging analysis algorithm. Imagine after we curate this large image data set, we have to be able to process all these images within few minutes after data acquisition. Otherwise, the cells that you are interested in might already move away from the dish. So this is second important element. And the third important element is a way to selectively isolate the cells that you want. And here we use a photo labeling approach. So these are three elements. I just got a chance to have the experience during my postdoc about 7 to 8 years ago in Boston. And then during the period, I also happened to have a collaborative project with the Oncode Institute using single-cell sequencing. And I also learned and I also knew there was a limitation of the current state of our single-cell sequencing method is that we cannot link the profile genotypes with the phenotypes that we are interested in. So that is basically where the idea came from, because I thought, why don't we just combine these two parts together? And that's where and how I came up with it.
Did it help to be part of Oncode Institute to help make your vision reality?
Yeah, absolutely. So being part of Oncode actually help in the sense that we develop technologies, and obviously in our group we also apply the technologies to study cancers. But in the Oncode community, we actually have so many experts. They study the cancer from completely different angles. For instance, how cells escape immunotherapy, how cancer cells could evolve beneficial mutations, or maybe how some cancer cells can trigger efficient DNA damage repair pathway, etc. So I was fortunate enough to be able to collaborate with some of the Oncode PIs and to using our technology to better understand cancer in a finer detail or in an unprecedented way. And obviously I also got a lot of support from visualization team as well, so that it could help us to form this facility much smoother.
If you can land your big paper in Cell, Nature or Science and you have to choose, which one will it be?
Nature.
And why?
Well, because we tried that before and we came quite far, but it didn't work out in the end. So yeah, I would love to have that.
Cell.
And why?
Because they have enough figures in it. There's like quite a lot of figures and the articles are quite complete, and I don't know.
Recently, Cancer Research Horizon and Oncode Institute announced that they have joined forces in a strategic alliance aiming at fostering innovation and collaboration between world-leading cancer researchers. Oncode investigator Jos Jonkers is part of the first collaborative project being set up right now. What's in your view the biggest added value of the partnership between Oncode and Cancer Research Horizons?
Well, I think they both share the same mission, so to help improving patients' life. But they're also both complementary and synergistic. So they're complementary because CRUK has a substantial drug discovery effort, which we don't have in the Netherlands yet. And on the other hand, the synergy comes from the fact that there's a much broader research base when you merge the two countries. So when it comes to discovering new targets and developing new drugs, I think together we're much stronger.
It's really a new collaborative effort, and collaboration is actually also one of the three pillars Oncode is built on. If you reflect on the past 4.5, 5 years of Oncode, what stands out for you in this respect?
Well, I think we've always been very collaborative in our research. That's how I function, and that's why I like Oncode so much, because really it created a much bigger beehive of groups that are stimulated to collaborate much closer together than they were before. So maybe it hasn't changed so much for us as an individual group, but our environment has become much more collaborative, I think.
Luca Braccioli and Moritz Bauer met during the very first Oncode postdoc retreat in the early fall of 2021. At the meeting, they came up with the idea to set up their own meeting dedicated to artificial embryos.
Oncode gave the opportunity to reach out to other scientists that are like-minded and they share the same enthusiasm and passion for the same research I do, and that led to indeed like new opportunities and challenges that I hope to explore in the future.
For me, I think, especially as an expat here coming to a new country, I think it's very obvious that you immediately have a network. And so I think that is the biggest takeaway for me, that I come somewhere and there's all these people I can already talk to immediately. And that just was immensely helpful for me.
So you both co-organized an artificial embryo meeting, if I pronounce it correctly.
Yes.
So for you, Luca, what were the key takeaways from this experience, from organizing such a meeting?
Well, the first most important lesson was indeed that creating a community of people that share the same research interest, the same passion for science, can really bring forward ideas and interactions that are really fruitful. And also the opportunity of organizing such an event was really enlightening in terms of like what you need to organize and like the logistics behind it. So I think I learned a lot through it as well.
Any golden advice for any scientist out there looking for these kind of initiatives or other initiatives?
Yeah, I think for some people it always can be a bit daunting at first, but I always follow a very simple strategy, and this is like the +1. This is how I met Luca, through a +1. I have a common friend. Oh, hello, have you met Luca? And you can go on from that. From Luca, you'll meet another person. So if you feel a bit daunted by that, just try that. Find your +1 in there.
If you want to meet new researchers at a networking drinks, what will be your opening line?
Hello.
Hi, in which lab are you?
Hi, I saw your presentation, I really liked it.